Hi, my name is Gail Hyman, and I'm a dental hygienist at the office of Goldstein, Garber, and Salama in Atlanta, Georgia. We have implemented a program where we are actively screening our patients for sleep-breathing disorder. Pana is a patient that's come through hygiene who reports that he snores at night and that he has excessive sleepiness. He has filled out a form called the Epworth Sleepiness Scale, and with this we have the information that we can initiate our initial screening.
You saw, based upon the questionnaire of the patient and the questions that were asked by the assistant, that this patient probably would benefit from a sleep study here at the office. What we usually do once we find this out, that the patient is a candidate, is we take them through a sleep study in the office, or an airway study, not a sleep study. And we're utilizing the EchoVision acoustic pharyngometer. And what this does, this appliance is, it's inserted into the patient's mouth. And once it's in the patient's mouth, this information on normal breathing gives us an idea of the volume of the patient's airway. Another device that we utilize to test to make sure that there's no issues with the nose is also a EchoVision device that's placed inside the nose. It's a rhinometer that tests whether or not there's any collapse of the nasal passages. That could be due to blockages, could be possibly due to a sinus involvement, or where they have congestion. Obviously, if that's the case, we'd want to treat that or let them place Afrin in their nose to open up those airway passages. Or it could be turbinate problems or some type of internal derangement of the septum. We want to make sure that the problem isn't in the nose, and this will rule that out as well. So one of the first things that we put Pana through is a simple study, a simple test that would lead us to believe whether or not the stability of his airway. If you're taking a look at the screen here, what we've done is we've taken him through a pharyngometer test, two of them. One to evaluate the size of his airway, what you see in the green lines. And then the second, the purple graph here, to see the stability of his airway, the collapsibility of his airway. The first one is done through normal breathing, just when he breathes through the pharyngometer. The second one is done when he takes a breath and then he breathes out to show the stability of his airway through that movement. And what we want to see is whether or not his airway that he has is something that is collapsible, and if he's losing a lot of volume of his airway when he actually is breathing it, certainly at nighttime. What we wanted to do is to test whether or not an oral sleep apnea appliance can be inserted in the mouth that would stabilize and open Pana's airway. And what we did just now, what you've seen on the video, is our assistants went through a number of different positions with these airway metric devices. And these are just little bite jigs, basically, that position the mandible downward and forward at different positions for bite opening and mandibular advancement. This appliance has now been fabricated, and this appliance will hold that same position that we believe is the best position for you to be sleeping in. Okay, so what we're going to do, and what this appliance does, is it gives us the ability to hold Pana's jaw in a forward position. If you're taking a look, there's a screw here for us to basically modify the position of the jaw. If we want a more forward position after further evaluation, we can always adjust that. So it leaves room for adjustment. Look, you'll see the fins in the back make certain that he can't set his jaw any further back. So the fins lock in and slide. So they slide on each other as the jaw comes forward, only allows him to go forward. And you'll see the opening in his two appliances that allow for his airway. And we'll be following Pana over the next several weeks to make sure and ascertain the fact that the results of the appliance are improving his obstructive sleep apnea.